Now that we have an understanding of what weight bias is, I want to start looking at what we can actually do to address it. And that is one of the goals of the 2017 Canadian Weight Bias Summit, where they had a brokered dialogue approach where different experts in obesity came together to be like, okay, what are the key messages that we want to get out there about weight that are going to reduce weight bias, and what are the things we can actually do to reduce weight bias as well? So as far as their key messages about weight and weight bias, one of the first things that they wanted to get across, or is going to inform everything they get across, is that weight bias and obesity discrimination is not okay, and it will not be tolerated. Okay, so their main point, their main message is like, not cool, not okay, and won't be tolerated. Number two, that obesity should be recognized as a chronic disease in pretty much all sectors. And yes, we've looked at how obesity has been declared a disease by the Canadian and the American Medical Association, but not everyone fully, actually mentally recognizes it as a disease. So we want to keep advocating for that. Okay? And also they suggest a decoupling of weight and health. So we can't just think that obesity is the only thing that affects someone's health. And if someone comes to us with obesity, we have to look at them beyond just their disease of obesity and all the other things that might affect their health as well. And when we're promoting health, we can't just look at reducing obesity as the only way to promote health, because there's other things that promote it as well. Not everyone has a weight-centered approach to health. And there's other approaches to health as well. So yes, obesity is a problem and it can affect health, but we also need to look at health on its own as well, decoupling the linkages between those two as the only approach. Okay. As far as strategies that kind of go along with this, creating resources to support policymakers, which is one of the things you guys are going to do in your final project this semester. They also have this nothing about me without me approach. And this is something we talked about in 340, that if you're going to work with a population, you can't just go into that population and tell them what they need. We actually have to listen to that population and figure out what's actually going on. What's it like to live with obesity? What's it like to have the certain causes of obesity you have, and to have lived the life you've had? And what does this actually lead to in your life, and how can we actually make a difference? Let's talk to these people that are affected by whatever we're dealing with, instead of just telling them what to do, So if you go to a Canadian Obesity Conference, you'll notice at the beginning of every session, there's typically someone who is currently living with obesity who is going to tell you about their own situation, maybe what their experience with bariatric surgery was, maybe their experience with their own weight from an early age, to again humanize the disease and for us to understand what it's actually like to live with it. Okay, and then developing a better clinical definition for obesity is part of their main strategies as well. And that's part of what that Edmonton obesity staging system is trying to do, and doing quite effectively actually, is to classify people with respect to obesity by not just what their BMI is, but also how that affects their physical and mental well-being. Another way to approach weight bias is to reduce the amount of weight bias that is seen in the media. Right now, individuals with obesity are portrayed in very unflattering lights in the media. They're often shown just their bellies, just their abdomens, often with their shirt riding up, and let's say there's food on them as well. Maybe they're watching TV, or looking really lazy. Often they're shown just from the back. Often they're shown without heads. And it's very dehumanizing how individuals with obesity are portrayed. And that's why Obesity Canada has this free resource, this image bank of individuals with obesity looking human and doing human things. And I suggest, if you need pictures to complement some of the things you produce this semester, this is potentially a resource that can help you with that. You just have to give credit to the organization. In a healthcare setting, certain things that can improve potential weight bias is to ideally make healthcare providers more empathetic, perhaps by educating them about the complexity of obesity or helping them have a more understanding of what it's like to live with obesity, which is again what we try to do in that Canadian Obesity Conference by having those patient perspectives. We also ask providers to examine their own biases, something I'm asking you to do this semester, to look at your own biases and to realize that you have them, and to realize when they're creeping up and influencing how you're looking at something or how you're decision making about something. And ideally, by examining our own biases and improving empathy, that can change some of the perceived norms around stigma. Because like we said, it's very normalized to stigmatize individuals with obesity, and it's like almost acceptable these days, and we want to shift that. Okay? We can also, and there's a lot of people that advocate for having not only a weight-centered approach. So when individuals with obesity come into our practice, not all of them are trying to lose weight. Some of them are, not all of them are. But we often think that anyone with obesity is trying to lose weight, and we have that approach with them. Okay, but maybe we shift the focus away from weight into just healthy behaviors, right? Or looking at that person and what else is going on in their life. Perhaps through motivational interviewing, which is a more patient-centered approach, in which we looked at in 340, where it's about not a doctor or a healthcare professional telling someone what to do, but through dialogue, figuring out what's going to work best for that person. Okay, having a better environment, like better chairs and desks and things that are suited for different types of bodies, showing that diversity is valued, perhaps by having different pictures on the wall or things that show bodies of different sizes and shapes. Okay, and then systemic solutions as well, like not just looking at the medical community as a way to treat obesity or manage obesity, but also having referral services for the other things that can affect obesity, like psychology, like dietetics, like kinesiologists, for instance, as well, but having more of a systemic approach to obesity as opposed to just more of a reductionist approach to it. Something else that we advocate for is using people's first language. We don't currently do this typically with obesity. Typically with obesity, we say things like obese person or fat person. And the issue with that is that we're saying that obesity is an identity. Just like if you say homeless person, what you're basically saying is homeless is that person's identity. Anorexic person, we're saying that anorexic is that person's identity, and that's not their identity. People are more complex than just one single thing about them, especially not their disease. Okay, so instead of talking about people by first listing their disease or their situation, we talk about the person first. Individual with obesity, person with obesity. Okay, person in a larger body. And I expect you in anything that you produce this semester that's going to be marked to use people's first language. And you will lose marks if you don't, because I really want to ingrain this in your head. Okay, so the American Medical Association, they advocate for this, and they advocate for avoiding to label people and thus equate people with their situation. So instead of saying the blind or schizophrenics or epileptics, we put the person first. So person with epilepsy, person with schizophrenia, okay, individual with. Okay, and we also want to avoid terms that suggest helplessness, like a person afflicted by obesity or a person suffering from obesity or stricken from. Okay, so individual with obesity, that's good enough there. Okay, that said, in the literature, we often see the opposite. We don't typically see people first language. That's a lot less common. What we typically see is the disease first language, obese person. And we see this with obesity, but we don't necessarily see it with other diseases. So for instance, it's a lot less common to see diabetic person, where the disease comes first. What's more common to see person with diabetes or people with diabetes. Okay, in the same respect, you don't expect to see like cancerous person. You expect to see person with cancer instead of defining that person by their disease. Okay, so hopefully this entire first module really is going to set the stage for the semester, where we're going to frame things from the perspective that people with obesity are people and that we need to consider that they're all different and they're equally lovable and they're equally worth caring for and providing good attention to, and that we need to examine our own biases, which we have. We understand our own biases, examine our own biases, so we understand when we're having these negative perspectives towards anyone that's different than us. We try to figure out why we're doing that and ideally lessen that, because at the end of the day, we are all equal, and that's how I want to approach this semester.